Hello, everyone. Greetings for the day. I'm Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. Well, we all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is a very common on your skin or nails. Fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal infections can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. Tanuja Tamhankar, live from Pune, to enlighten us on the topic of fungal management. Dr. Tanuja is an MBBS, DDVL, and has been practicing dermatology, cosmetology for the last 15 years. She is a graduate from Seth GS Medical College and Kim Hospital, Mumbai, and did her post graduation in dermatology at Vijayanagar Institute of Medical Sciences in Karnataka. She worked at KEM Hospital, Mumbai. Today, Dr. Tanuja will share with us on fungal management. First of all, welcome, Doctor, to today's platform. We are extremely delighted to have you here today, and we are looking forward to an amazing session today. Doctor, the first question for you would be, of course, the very normal question: what is fungal infection?
So basically, fungal infection is like any organism, like there are a variety of organisms. This is one of the organism usually what we see in like when we keep our food outside in rainy seasons, we can see fungus thriving over that. So similarly, there are few fungal infections which are thriving in our body, and that time we called it as fungal infections. So basically, these are mycetas, these are funguses which thrives in our body. So it can be over skin. Since I'm a dermatologist, so today we will be dealing with mainly the fungal infection which affects the skin.
Right, right. Doctor, skin being the largest organ, we see a lot of changes in the different parts of skin as well. Suppose, say that हमारे फेस में कुछ अलग टाइप का मे बी फॉर्मेशन दिखेगा फंगस का, या हमारे नेल्स के साइड में कुछ अलग फॉर्मेशन दिखेगा मे बी. So why does it happen, and how do a person know that it's a fungal infection? That is the first stage. What does the first stage normally look like?
So basically, अगर हम लोग देखेंगे कि how fungal infection presents in our body, so it
Right.
presents in variety of ways. So
Mm.
if we go to the part of the body where it presents, so it can be tinea. We usually call the fungal infections tinea infections. So
Right.
if it's in the face, then we call it tinea fasciae. If it is over the scalp, we call it tinea barbae. If it is over the body, then we call it tinea corporis. If it is over the like the itch, the groin area, then it is tinea corporis. If it is over the nails, we call it onychomycosis. So
Okay.
how to how to identify, since fungal infection is one of the most commonest infections which presents to our OPD, and many a times it is easily diagnosed if it is presenting for the first time. फर्स्ट टाइम आई
Mm-hmm.
मीन दैट पेशेंट हैज नॉट इंटरवीन इनटू इट, उसने कुछ अलग से क्रीम्स नहीं लगाए हैं, तो उसका मॉर्फोलॉजी देखने में इट्स वेरी टिपिकल. इट टिपिकल एज वी से दैट इज रिंग वर्म. व्हाई वी कॉल इट एज अ रिंग वर्म? बिकॉज इट प्रेजेंट्स इन लाइक रिंग काइंड ऑफ पैटर्न where the margins are elevated and inside it is flat, and it is red in color and very itchy. So majority of times when a patient presents with a like itchiness over the groin, majority times 99% of times it becomes a fungal infection. So it is that common. So many a times, and patients, what is happening is patients are like using products which are they not supposed to use, and that is causing the main problem. The
Right.
morphology of the lesion changes, it become more resistant. So that's the case. So basically it's very easily recognizable. If we talk about just the fungal infection of the skin, in scalp, it presents in a different way, where there's a loss of hairs, there's a patchiness, they can be like a swelling kind of thing over the scalp. So that all features can be seen. If it is nails involvement, then the nail become thickened, and it is nails become thickened, yellowish in color, and the margins are very scaly. So in this way, in different areas, it presents in different ways.
Right. So how do one tackle with it? what is the first way, the first step one should take when he or she notices some changes in the skin?
Yeah. So, first thing, most importantly, whenever you, for patients, especially whenever you feel that you are having fungal infections, then you
Hmm.
should meet your dermatologist. That is the first thing, and
Right.
get it diagnosed that this is a fungal infection, and a proper treatment duration. You have to follow a proper duration of the treatment. That is becomes the most important thing, because
Mm-hmm.
as we'll go later, we'll come to know that. The fungal infection are a bit recurrent kind of infection which are happening, and there are many reasons for it. So whatever the doctor says, please do follow it, because many a times what happens about skin is, till the time you have problem, you just try to take the treatment. The moment you are better, you just stop everything. So this
Right.
doesn't work with fungus. So for
Right.
fungal infection, you have to adhere to the treatment for a proper duration, and whatever the precautions the doctor has suggested, that we have to take into consideration.
Right. Speaking about the treatment, doctor, which you have just mentioned, what are the treatments available currently?
Yes. Treatments, basically, first, I would like to divide the fungal infection. Majority of times when we see a fungal infection, there are of the skin, basically, this is superficial fungal infection. And in that, there are two types of organism. One are dermatophytes, and the other one is candida infection. So the
Mm.
presentation and the treatment of both of these disorder, or both of these fungal infections, are different. So if we talk about dermatophyte, which is commonly called as the ringworm, so in ringworm, what happens is, like, depend upon what is the stage, how much involvement of the area is there, accordingly we have treatment available. Mainly there are creams available and systemic drugs, as well as soaps and all, which we prescribe. So if we talk about the creams, there are imidazoles like clotrimazole, miconazole, oxyconazole, secnidazole. So these are the creams which are mainly available. There are lalamines like terbinafine, and there are triazoles like itraconazole, fluconazole. So these are the mainly drugs which are available, which we give according what is the presentation of the patient, and the duration will be determined what kind of presentation the patient has come with. Many a times patient has self treated themselves. What happens is, they just go to the chemist, and the chemist person gives them a combination of creams which are like antifungal, steroids, and antibacterial cream, which is like a triple kind of one cream. For whatever happens, you apply that kind of cream, and temporary the patients get benefits because it has steroid in that. But the moment you stop it, the fungus again comes back. And the main problem with that is that patient goes for resistant strains. The chances of we getting treated fungus primarily becomes less, and then the patient gets again and again recurrent fungal infection. So it is very important that you adhere to the treatment duration, as well as not using of steroid. So steroid makes things worse.
Right, right. So, doctor, like the what you have just said, this is the basic problem which everyone is facing, the reoccurrence of fungal infection again and again. What if a patient is already cured? Is there any chances of reoccurrence again? Is there anything, any precautionary measures which they need to take after they are cured as well?
Yes, this is a very important question, and it's the burning question for fungal infection, because majority
Right.
of patients, first thing, that the full family is involved. Second thing
Mm.
is, they are again and again getting it, chances of recurrence. So there are, if we categorically see, recurrence can occur because of two reasons. First is like patient based, like patient immunity as such is less, and that time, because of the less immune function, the patient is recurrently getting infection. The other
Right.
is the fungus is of resistant strain. So this is like fungus dependent. The
Mm.
kind of fungus you are having is resistant to antibiotic or antifungals. So
Right.
for treating both, we have to find out the reason behind it, why the patient is getting the recurrence, and we have to treat that appropriately. Like if it is immune deficiency, then we have to treat whatever the reason for the immune deficiency. We have to make the immunity better. So, and if it is because of the fungus related things, then we have to give at a time multiple drugs so that the fungus gets treated, and the duration is also more. So that is the thing which we have to look into whenever we are
Right.
treating with recurrent kind of fungal infections.
Right, right. Doctor, we know we are talking about fungal infections today, but we are also talking about the main reason behind the recurrence or the occurrence of fungal infection, which is good immunity or a bad immunity. After COVID, we have understood that having a good lifestyle, having a good diet, having a good immunity system is so much important. Maybe it was always there, or maybe we have never thought about it before, and now that we are a little conscious about it, we are a little conscious about the body. uh, is there, just a little out of the context question, is there a little change in the patients which you are attaining these days? Does the immunity, like, has it gone better after COVID, or was it better before COVID? What do you have to say about that?
Actually, if we see that, it's like I don't see any difference. So earlier also the patients were having the same problems if at all fungal infection is concerned, and now also it is better. What we can see is like since patients have become more conscious about their lifestyle, and
Mm-hmm.
they know that what are the causes of lower immunity, so it can become better. But now it's difficult to answer that because I have not actually thought about it and seen any like changes in that way.
Right.
So
Now coming back to the same topic again, doctor, what antibiotics do are treated by fungal infections? Like, what
so
antibiotics treat fungal infections?
So antibiotics, if we see that mainly the drug of choice becomes if the patient is quite healthy and doesn't have any comorbidities, then triazoles become the first line treatment which we give, like itraconazole and fluconazoles. Then there are very drug which is grisopulmin, which was earlier like it was outdated kind of drug, which is like come again into the picture in recent years. So that grisoparlin becomes one of the drug for fungal infection, and then we have allylamines like terbinafine and drugs like that. And along with that, we have imidazoles, which are the topical versions, the topical creams, which are available in the market for treating the fungus, like clotrimazole, metronidazole, secmetrazole, and other drugs. So mainly these creams as well as the drugs, and along with that we sometimes we give like soaps and all, like ketoconazole body washes and soaps, to prevent
Mhm.
the fungus from thriving in the body, so that again and again you should not get the infection.
Right. Now, when we are already talking about antibiotics, can a long-term usage or dosage of antibiotic affect the patient somehow?
Yes, it can. There are side effect profiles associated with the drugs, so we have to be. It cannot be taken lifelong or for a very long time. But if the patient is getting recurrence, then we have to give. But at the same time, we have to get all the blood tests done. We have to see whether the patient is fit enough for starting of the antibiotic or antifungals for a long term. So we have to check
Right.
routine checkups, routine looking for symptoms of or side effects of the drugs. We have to do that. So routine checkup is required whenever we are on antifungals.
राइट राइट डॉक्टर, वी ऑल्सो नो दैट जितने भी हमारे व्यूअर्स अभी हमें फिलहाल देख रहे हैं, सभी जो है, या ह्यूमन टेंडेंसी होता है कि कोई भी चीज अगर बीमारी दिखे या कोई भी चेंजेस दिखे बॉडी में, तो हम उसे बहुत प्रोलॉन्ग करते हैं, वी डिले इट फॉर अ लॉन्ग टाइम.
हाँ
सो सो what if a patient is delaying it already? People who are watching us right now, they are thinking कि अरे मेरे स्किन में भी चेंज है, पर मैंने अभी तक दिखाया नहीं, ठीक है अपने से ठीक हो जाएगा, घरेलू नुस्खे अपना लेंगे, और ठीक है किसी बड़ों का सलाह ले लेंगे. वी ऑल, हम इंडियंस है, हम सभी डॉक्टर्स हैं, हमें सब पता है ऑलरेडी. सो व्हाट फॉर देम, आप उनके लिए क्या बोलना चाहेंगे? ये फंगल इन्फेक्शन का सबसे वर्स्ट केस सिनेरियो क्या हो सकता है?
वर्स्ट केस सिनेरियो जो अभी मैंने पहले भी बताया कि क्या होता है कि जब भी कुछ इचिंग होती है या ये होता है, जब भी ऐसे लगता है कि बॉडी में इचिंग आ रही है, कुछ रैश आ रहा है, तो हम लोग जाते हैं केमिस्ट के पास,
Hmm.
एंड केमिस्ट के पास जाके उनसे कहते हैं क्रीम दे दो, एंड दे
Right.
गिव अ क्रीम which I already told, which is majority times steroidal based cream रहते हैं, जो कि it temporarily reduces the inflammation, तो temporary
Hmm.
relief मिल जाता है पेशेंट को, and patient is happy. प्रॉब्लम कहाँ पे आती है? व्हेन दे स्टॉप दैट क्रीम फॉर फ्यू डेज, दे विल
Hmm.
अप्लाई दैट क्रीम एंड दे स्टॉप इट. तो जब वो बंद करते हैं, देन द थिंग बिकम्स वर्स, फर्स्ट थिंग. अदर थिंग इज इट बिकम्स रेजिस्टेंट टू ड्रग बिकॉज बिकॉज ऑफ द लॉन्ग टर्म स्टेरॉइड यूज. थर्ड थिंग, उसका मॉर्फोलॉजी भी चेंज हो जाता है, तो समटाइम इट बिकम्स डिफिकल्ट टू डायग्नोस ऑल्सो. सो उस
Hmm.
कंडीशन को
Hmm.
हम
Hmm.
लोग टीनिया इनकॉग्निटो बोलते हैं, जब स्टेरॉइड इंड्यूस व्हेन द मॉर्फोलॉजी ऑफ फंगस जैसी होनी चाहिए वैसी नहीं है, कुछ अलग है, तो उसको टीनिया
Hmm.
इनकॉग्निटो बोलते हैं. तो दे प्रेजेंट दैट वे. सो समटाइम्स इट इज मिसट्रीटेड फ्रॉम द डर्मेटोलॉजिस्ट ऑल्सो बिकॉज दैट कंडीशन लुक्स डिफरेंट.
Hmm.
तो इसलिए ये सब प्रॉब्लम्स आते हैं विद द स्टीरॉइड यूज. सो सबसे पहली चीज आपको ध्यान रखना है कि इसके लिए बहुत सारे कैंपेन भी चलते हैं कि स्टीरॉइड का मिसयूज नहीं होना चाहिए. तो फंगल इन्फेक्शन इज वन ऑफ द एरियाज वेयर स्टीरॉइड का डेफिनेट मिसयूज होता है. एंड जब वो मिसयूज होता है तो उसका नुकसान जो होता है वो पेशेंट को ही भुगतना पड़ता है, क्योंकि उनकी इचिंग नहीं जाती है. आई एम टेलिंग यू, आई हैव सीन पेशेंट्स वेयर दे आर हैविंग फंगल इन्फेक्शन सिंस years, and it is really affecting the quality of life of the patient because it is affecting in areas where you cannot itch also, and you become very uncomfortable while doing your work. So it is very important कि आप ध्यान दें कि आप उसको गलत तरीके से ना ट्रीट करें, एट द सेम टाइम इसको इग्नोर भी ना करें, उसको अपनी बॉडी से रिमूव करने की कोशिश करें. क्योंकि इसमें सर्च में अपने को क्या होता है कि अपने अंदर जो कमियां है वो दिख जाती है. जैसे कि अगर कुछ इम्यून डिफिशियंसी है, तो मेजोरिटी ऑफ टाइम्स इम्यून डिफिशियंसी किस कारण से होती है? मे बी डायबिटीज की वजह से हो जाती है, या फिर कुछ वाइटामिन डिफिशियंसी की हो जाती है. तो अदर रीजंस इज कैंसर एंड बाकी के मतलब इम्पोर्टेंट जो वो अपने हाथ में नहीं है वो रीजंस रहते हैं इसके. लेकिन जो अपने हाथ में है, जो मेजोरिटी 90% ऑफ लोगों के होते हैं बिकॉज ऑफ डेफिशिएंसीज और बिकॉज ऑफ डायबिटीज. तो ये दो चीजें डायग्नोस होती है हमारी. एंड व्हेन
Hmm.
these two things are diagnosed, then we will work to correct that internally, and then our fungus will be treated, है ना?
Right.
So इसलिए it is very important whenever the skin issue is there, you have to show it to doctor, so that that person can guide you in in a way where you are treating your main problem.
Right. Well, we always say our viewers that precaution is better than cure. तो आप अपने किसी भी शारीरिक बदलाव को प्लीज ज्यादा डिले ना करें. इमीडिएटली हमारे एक्सपर्ट्स के पास जाए. दे आर ऑलवेज देयर टू हेल्प यू आउट. डॉक्टर, विल क्विकली मूव ऑन टू द नेक्स्ट क्वेश्चन. द नेक्स्ट क्वेश्चन इज, कैन oral antifungal drugs be taken during pregnancy?
There are first trimester drugs are as in we cannot advise drugs in first trimester, but
Hmm.
in from second trimester there are few drugs like fluconazole and terbinafine which can be safely given. So that's not a big issue. But as far as possible, we avoid that.
Right, right. The next question, doctor, is there a way I can prevent getting ringworm on my feet frequently?
Um, in your feet actually it's called as athlete foot, and in that mainly it affects the web spaces. So first thing is we have to make sure that we are keeping that area dry. We are we are using antifungal powders and stuff like that over that area. We are using antifungal soaps if you have tendency of getting and you have to stop wearing your shoes and all for long term. So you have to keep your feet drier. So that is the most important thing. And other thing is definitely the other part that you have to get checked if you have diabetes or all, or you have how your body profile is, your deficiency profile is there or not.
Mm-hmm.
That you have to check and you have to correct that. So correction is always the internal correction as well as the preventive measure for prevention of the fungus.
Right. But, doctor, can walking bare feet also be the reason of the occurrence of ringworm?
Bare feet, basically we get fungus from the feet, and mainly we are exposed, everyone is exposed to all the
Mm-hmm.
infections basically. Only few people get
Mm-hmm.
it. So there are immune mediated factors inside our body which was like we are more immunologically
Mm.
prone for that disease. That is one thing. And other thing is like the if we have some cuts, if we have some traumatic thing which will allow the fungus to enter, like for nails especially, if you are walking barefoot and if you have a nail injury, then you are more likely to get a fungal infection of the nail, and if you are
Mm-hmm.
immunologically a proper candidate for getting a fungus basically. So it's always the environmental factor, the
Right,
individual factor, and the factors around that area, whether that thing is there in that environment or not. So yes,
right.
there can be you can get after walking barefoot if you are a correct candidate for getting that infection. Otherwise, for normal people, definitely they won't. Their immunity
Right.
is strong enough to they will obviously shoo away the infections.
Right, right. Doctor, well, I can see a lot of viewers interacting already. I believe काफी लोग suffer कर रहे हैं same issue से. The first question comes from Pooja Sharma, who asks, what are the hardest parts about finding and treating fungal infections, and how do we deal with them?
Hardest part is treating the recurrence.
Hmm.
Recurrent cases, patients who have applied steroids and long-term steroidal use, because we cannot stop the steroid immediately. We have to taper
Hmm.
it down. The moment we taper it, again, patient is not very comfortable. They will get the relapse of it. So for me, mainly the recurrences because of the steroidal use is the most difficult part.
Right. Doctor, the next question would be from my side. So, can anxiety, somehow trigger fungal infections? Is there any connection between both of them?
Not really, actually, if we see, but anxiety triggering fungal infection is not known actually. But what we can say is the other way around, that if you have anxiety, there are some other pruritic disorders, like you will get itching and all, and with
Hmm.
itching and all, you might get fungus there. So direct
Right,
correlation is not there actually for
right, right.
fungus.
So there is no
Humor
direct
is there.
relation, but yes,
Yeah. Yeah,
somehow
for
it can.
it's there, but not for fungus, basically. Fungal is the
Right.
infections. Right.
Right, right. Okay, doctor. Now let's quickly move on to the next question. The next question comes from Ahana, who asks, how do we know if a skin problem is caused by a fungus or something else? And what's the right treatment?
There are few diagnostic signs for fungus. Basically, whenever we get a fungal patient, majority of times it is a clinical diagnosis, which like according to which part of the body is affected. There are few parts which are more affected, like the groin area, like beneath your breast, the basically the flexural areas, or
Mm-hmm.
over your body that time also. And the presentation of fungus is also very typical, like it's like a ring kind, which is like a peripherally, it's elevated reddish region which is itchy, and the central clearing is there, so that's why it's called as ringworm. So these are the very characteristic findings which the patient presents with, and which is hard to miss actually. I mean, majority of times it's easily diagnosed, but sometimes, as I said earlier, that sometimes the presentation is different, then we have to think about many other things also. But and then after that we can do KOH mount. We can like take the scrapings from the skin, and we can see it under microscopes, and we can see the hyphae and all easily. So when the hyphae is seen, it's mostly fungal. It's like a diagnosis is confirmed. So that way we have to go forward.
Right. Well, that was a very detailed answer, Hannah. I believe you have got your answer already. The next question comes from Yash Namdev, who asks, what recent advancements exist in fungal management, including new treatment options and diagnostic methods?
Diagnostic methods, like since fungal is a very age-old kind of disorder, and
Mm,
only thing is newer antibiotics, definitely they are coming up, and newer way of treatment they are coming up. Like nowadays, like what we do is like for resistant cases, we can use chemicals to exfoliate the skin. We can remove the part of the layer. Sometimes patients are doing lasers also, like to induce a bit of trauma there, as in if you are giving trauma there, and there what will happen is your immune functions will be coming into picture, and they will try to throw the fungus out, and then we have to treat in a different way. So there are few modalities which we have which we have seen while treating a fungal infections.
The next question, doctor, comes from Neha Sharma, who asks, what strategy do you suggest for preventing recurrent fungal infections in chronic conditions?
Yes. So getting the treatment in a proper way, the drugs, taking the drug screen, whatever has been prescribed, do follow that. That is the most important thing. Other thing is like you have to keep your body as dry as possible. So basically, fungus thrives where there is moisture, wherever the body gets a chance of getting moisture, there the fungus will thrive. So if you're keeping your body drier, like especially after bathe and all, you have to like keep properly dry it. If you are in especially in rainy seasons, if you are wet and all, then you have to change your clothes. Try to wear cotton clothes which are loose fitting, not very tight one. Then using antifungal powders. And what I have like in my clinical practice have helped a lot in my patients is using of ketoconazole based soaps, antifungal based soaps over a long term. Even if the lesion is not there, try to use the soap so that the whatever the fungus is coming into contact get washed away, or your
Mhm.
body is protected in a way. So immediately if infestation is there, if a fungus comes to a body, immediately infection doesn't occur. First it will thrive into the body, and then so the moment you wash it off, the chances of you getting the fungal infection becomes less. So using of antifungal soaps also helps. Nowadays body washes is also available.
Right. Doctor, a little related to the answer which you have just mentioned, the vaginal area, it tends to be moist all the time. And we also see women drastically suffering from fungal infection nowadays. The reason might be using like the toilets outside, the common toilets, the pain-use toilets which we have, or maybe, of course, the immunity, the low immunity, which you have already mentioned. So, what about them? How do they take care of it? How do they know whom to visit, a gynac or a dermatologist? Please enlighten us on that.
Both can treat vaginal infections. Sometimes
Mhm.
gynec only refers to dermatologists for the vaginal infections, because we are dealing with more fungal infections, the drugs and all, we deal more about it for resistant
Right.
cases. So basically, it's like dermats can easily treat the vaginal infection if it is fungal infection. So definitely
Mm-hmm.
dermatologist. And the other part is how we get it. And see, one thing is like as you mentioned that low immunity, yes, definitely. Whenever you have like diabetes or immunity is less, we have to get ourselves checked for that. That is one of the most striking feature. Candida is thrives in patients who have like deficient in immunity. It can be because of the mainly diabetes and deficiencies. So if deficiencies are there, we have to correct it. I have seen in many of my patients having recurrent cases, I've started them with good a profile where I'm giving all the nutrients properly, and definitely their recurrence have stopped, or they are not getting frequent infections as they were
Mm-hmm.
earlier getting. So these drugs definitely help. And other thing is candida is a normal commensal in our anal area. Okay, and in
Right.
a vaginal area, it's not a it's the infection. So
Mm-hmm.
very it's a very thin area which prevents this infection. Okay. So we are already
Okay.
having this candida always in our anal
Okay.
area. And from
Mm-hmm.
there it gets transferred. So basically for my patients, what I ask them whenever you are like washing that anal area after your after your potty and all, that time don't
Yes.
use the same hand for washing your vagina, and
Right.
whenever you are into vagina area, try to avoid that area. So that zone we have to differentiate, because that's why females get candida infection more commonly as compared to
Right.
males, because males they have
Right.
a huge differences there in that area.
Mm-hmm.
So it's always better that you clean both the areas differently, and maintaining a vaginal pH, like it's not advisable to wash your vagina with soap and all. It's It's not advisable. So it's always better to maintain a good pH of your vagina. Cleaning of that area is important. Like after, like you use washroom, just have use water and all. But at the same time, you have to maintain that water is not staying there. So it will keep that area moist. So you have to clean that area also after washing it. So majority of times people what they do is they wash that area after urination and then they use the same underwear or whatever they're using. So so that time what happens, it becomes more moist, and
Mm.
for many hours you are into same moist environment. So changing of your underpants is important if you are having all these issues. So maintaining a good hygiene, mainly reducing the moisture, making your immunity better, and at the same time, earlier what I said, that cleaning the area differently is most important. And vaginal infection are also, they're easily treatable, and that's not a big issue. But only thing is you have to work from inside also.
Right, right. I mean, we are talking about such an important topic today, and Doctor, you have just mentioned the right thing. I believe not everybody talks about it. I have seen doctors, I have seen people who talk here and there. Maybe this is affecting, maybe this. Mostly, they are unable to understand what is the basic issue. But we are talking about the smallest, the most basic thing today, which we need to take care of on a regular basis. Doctor, well. Definitely, very, very rightly said. Women are very much suffering also is reoccurring, but अगर आप देखने जाएंगे तो बहुत बड़ी बात शायद नहीं होगी, पर छोटी सी बात की वजह से आप बार बार सफर कर रहे, तो छोटी चीजों का हमें ध्यान देना है, which we are
हाँ.
learning from our session today. We have Dr. Tanuja here with us, and as we initially mentioned, we are going to have a very, very interesting session today. Doctor, हमारा अगला सवाल आ रहा है Sheila Agarwalji, who asks, can you discuss the potential of probiotic in preventing or treating fungal infections in vulnerable patients?
Probiotics definitely, see, directly I'll say no. If there's direct correlation is not there, but nowadays gut has become a very important tool, and because from that gut, the bacteria which are present over the gut, they are releasing a lot of mediators in our body, which are working in all the organs. So definitely, indirectly, definitely, I'll say good, because you are in a healthy state. Your immunity is better. So directly, if I say there's no correlation, but indirectly, definitely probiotics will help. It will make your gut clean. It will make the bacteria will release good immunomediators from your body, and that really helps from all the angles, not just the skin, but it will make you, like, your inflammation will reduce. You will have the skin wise, the other skin issues will be settled definitely. Your immune mechanism will be better. Your mental capacity will be your all the functioning of the organs will be better. So definitely it will have good role indirectly, not directly.
Right. Doctor, there are a lot of vaginal washes now which are available on market, which I have seen people suggesting. Also, there is a part of the society who believes that a vagina naturally cleans itself. So just a normal water wash is enough. What do you
It
suggest?
is enough. It is enough. Ideally, it is enough. Our body is made in a way that it is enough. If I'm talking of healthy individuals, but if
Mm.
you have some problem areas where you are deficiency, if you are immunodeficiency and all, definitely that time we have to take a help. But one thing which I want to tell you that is overdoing is bad. So if you are like
Right.
some people, they have tendency of washing from inside everywhere. They feel that the urge to wash everywhere. So they're trying
Mm,
to put soaps and all inside the vagina and
mm,
cleaning it that way.
mm,
That is
mm,
definitely wrong. You should not do that, because endogenously our body is dependent on bacteria, good bacteria. So if we are
right,
not having that good micro environment around our areas, it is a bad thing. So whatever
right,
naturally for normal individual, it is always better that you don't do anything. Just
right.
wash with water, but don't try to enter inside the vagina, just
Mm,
outside.
mm, mm,
So
mm.
this practice of cleaning inside makes all the problems.
Right, right. So, doctor, like we women, I think we already know if there is any changes occurring in our body. We see certain changes there. The discharge color maybe, the texture maybe are different. So that is the moment I think we know that something is going wrong. So
Yes.
before that, I don't think so. It's required to do anything. You can just have a no. What do you say about that?
Yes. Yes, yeah, definitely. For if it is everything is normal, if there's normal discharges there, there's no foul smell, there's no other white discharge stuff like that, and you are
Mhm.
very healthy, sound. You don't need to do extra. Doing thing
Right,
extra will be more. It will cause problem than doing less. So you have to make sure that everything is, if everything is normal, don't do anything. But if you have like other issues, at that time definitely for some time you can use that, the
right.
washes I'm talking of, to maintaining
Perfect,
a proper
perfect.
balance.
Perfect. Well, the next question, doctor, comes from Deepak Saxena, who asks, "What challenges do you encounter in diagnosing and managing invasive fungal infections, and how do you address them?"
Invasive fungal infection, if you are talking of deep fungal infections, definitely we refer to the concerned person.
Mm,
We, as in, if the deep fungal infections are there, that time higher antibiotics. So we have to take help of physicians, and then we have to IV injections and all. They are like, but they are not very common. And if
mm,
internal fungal infections are there, definitely we refer to the concerned department. So
right.
we are like, as dermatologists, we are trained in treating the fungal infection of the skin, which are superficial. Majority of time, they are superficial infections, 99.99% of times, and can be easily treatable. And in case of deeper infections, that time we have to take the help of physicians also for the starting of drugs. IV injections and all are available that we have to give, and they are like sort of toxic, so we have to take help of them also in the
Right,
management.
right. Uh, right. Well, the next question, doctor, comes from Akansha Puri, who asks, "What imaging modalities do you recommend for diagnosing and treating suspected fungal cases?"
So that's what I earlier also I told that diagnostics it's with wood lamp. This like the if trichophyton is there, it becomes reddish kind of hue it gives. And for KOH mount, we can see the fungus with the scraping. We can see the fungus under microscope. And if we are in doubt, then we can do biopsies also. The biopsies are done, and we have to see it under histopathology. We have to see the spores and all to see. So that is the main diagnostic, but that is for very rare situations. Majority of times,
Mm-hmm.
it's like the clinical diagnosis, which we do, and it patient gets all right, and then we don't have to think about it. But in case of recurrences and everything, definitely sometimes biopsy is also required.
Right, right. Doctor, well, we had an amazing session today. Before we take a leave, do we have any take-home note for our viewers who has watched us so far?
Yes, the take home message will be, please don't use steroids for fungal infections, and stop using steroid. That is a main thing which I want to tell, that everything cannot be treated with steroid. It will cause more harm than good. So consult your dermatologist and get it treated properly, and make the whatever the treatment duration is, the duration of the treatment should be followed, because skin is an organ which has since it is in the upper layer, so it will be there for the body, in that fungus will be there in the body for 6 weeks or to 8 weeks. So for at
Mm,
least for that duration we have to treat it. So
right.
that is the take home message.
Right. Well, that was Dr. Tanuja for us. Thank you so much, Doctor, for your valuable time. It has been quite an informative session for our viewers today, and we look forward to many more such sessions in coming time. And thank
Thank
you,
you.
viewers, for your excellent participation. For more information and updates on skin health and care, stay connected on our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day. Stay safe and stay healthy.